All right, let me call the September 4th, 2025 meeting of the Gloucester Board of Health to order. It is 5:35 and we are in the Harbor Masters Conference Room. And I remind everyone that this is a hybrid meeting. The public is welcome to attend this meeting in person. However, there is a Zoom link available to remotely access the meeting. However, be aware that if the in-person meeting will not be suspended or terminated if technological problems interrupt the remote connection. So the first thing we usually do is for members of the staff and board to introduce themselves. Start with Chelsea.
Sure. Chelsea Goldstein Walsh, Regional Prevention Director.
Cindy Junker, Public Health Nurse.
Sophia Boreas, Food Inspector.
Dominique Curley, Health Director.
Cody Smith, Secretarian.
You started in value fits up to me.
Vice Chair.
Joe Rosa, Chair.
Erin George, Board of Health Member.
Very good. Thank you all. The first item on the agenda is public oral communication. That's an opportunity for members of the public to speak for up to 3 minutes on an item that is not on the agenda. Is there anyone?
We have no one on the line except for staff and our Bobby Orlando.
Oh, who staff?
Cody's on the line. Bree and Connor are also on the line.
So seeing no one, I presume no one here is wishing to speak on a non-agenda item. And let's approve the minutes of the previous board meeting, August 7th, 2025.
I have one comment. I didn't notice it when I first read it. I just read it again before I got here. And on agenda item 4, third paragraph of number 3.
Mr. Sargent stated.
It had, oh, here it is. He stated there, they are asking for upgrade approval to use a percolation test and move a percolation test. I think he meant it's gonna be a sieve test probably, and a percolation test. That's because the soil saturated, not because it was raining. It was agenda item 4.
Yep.
Number 3, third paragraph. Probably 4th sentence.
In lieu of a sieve test, is that what you meant? Because Cody needs your statements.
Mr.
So it says a percolation test, in lieu of a percolation test. Did you mean in lieu of a?
Sieve
test?
Yeah. Sieve test. That's the only comment I got.
All right,
And then we have, move that we accept the minutes
with the amendment.
and
And
the amendment. It's noted.
second,
I will second.
any further discussion? All in favor?
Erin, yes.
Joe Rosa, yes.
Erica, yes.
The minutes of August 7th are approved. And rather than moving on to what is likely to be a lengthy discussion, item 5, I'd like to propose that we address item 6 on the menu and allow that person to leave the meeting. That regards the approval of registration of the common DNA use from GMGI. So Maggie, did you want to address that? What is proposed to, what we have to approve?
So I am Maggie Rosa. I am the scribe for the Gloucester Biosafety Subcommittee. We met last week. Eric is also a member of the committee, as is Lynn Jackson, who is chair, and Dominique as member of the health department. We reviewed the application for registration of a recombinant sRNA project from the Gloucester Genomics, Gloucester Marine Genomics Institute. We approved unanimously recommendation of their application for registration. We commended, at least around the table, the application for its thoroughness. And it's addressing the potential safety issues. The project involves taking sea urchins, embryos, and deriving cell lines from these embryos that will be used in a study, basically to knock out a few genes that impact are thought possibly impact the lifetime of sea urchin shells. I'm not that familiar with the project, but I think that Dominique has the application. If any of the members of the Board of Health wish to see it and delve into the nitty-gritty details.
But this has been approved by.
It was approved for recommendation. Our job is to
Recommendation.
recommend to
The
the board.
board was unaware that the board had to approve it separately.
Yes.
So that's what we're about, right?
And in your packets was the letter from the Jackson, the chair, saying what Maggie just said, and then also the full application.
So can I have a motion that we accept that proposal?
I move that we accept the proposal.
And I
To
second.
accept the recommendation.
Any further discussion, comments? No? All in favor?
Aaron, yes.
Joe Rosa, yes.
Eric Kaplan, yes.
All right. Thank you, Maggie.
Thank you. Thank you, everybody.
Bye, Maggie.
And
Have a
thank you
great
to
day.
the committee as well. It's very good. So next item on the agenda, we'll go back to the listed agenda. And that is regards 95 Eastern Point Boulevard. And
Sure, yeah, I can take it
the
away.
judge is gonna
Yeah.
describe what's proposed.
Perfect. All right, hello, everyone. My name is Tyler Judd. I'm an engineer with Gateway Consultants, and I'll be speaking about this project here tonight at 95 Eastern Point Boulevard. So basically, the whole purpose of this project, or the idea, came about because the existing septic system is pretty undersized. It's 40 years old. And on top of that, the existing system is right along the coastal bank. And it's also within the FEMA flood zone. So we went out and we did some test bits with Cody, and as you can see where our proposed field is, in the bottom right of the screen, all the test bits were as far as we could away from the coastal resource areas. So it got us outside of all those buffers. We were able to find really good soils and okay depths between 25 to 45 inches. Which is why we're proposing the singular advanced tank. But due to existing plumbing and the ledge all around the house, we're proposing to put the singular tank and the pump chamber in the same location as the existing tank. And that was to avoid an insane amount of blasting. And on top of that, you can't do any plumbing realignment in the basement of the house. So we're really only asking for two variances. The first one is to situate the septic tank and pump chamber within 16 feet and 5 feet of the coastal bank. And same thing, situate the septic tank and pump chamber 16 feet and 7 feet away from the FEMA flood zone. So I can answer any technical questions you may have, but I'm going to pass this on to Cody with any comments that he has.
How many, please? How many bedrooms are there?
Right now, the existing structure, by Title V definition is an 8-bedroom house. So I just wanted to, it's kind of a unique project, back in 1987, the previous owner of the house, installed a new septic system. The septic system that currently serves the house is for a 4-bedroom house. The current design in front of you today is for a 5-bedroom system. And so this project, because it is an increase in flow from an existing septic system, needs to meet new construction standards. And it doesn't meet the new construction standards because it doesn't have a reserve field and they don't have 4 feet of naturally occurring soil. Therefore, we can't really approve the variances based on that. The applicant could come back and see if they meet the criteria for section 15.414 variances for increased flow to an existing system as a potential option. They could explore that. But as the plan kind of stands now, the capacity, regardless of the fact that the house is a 8-bedroom house, in 1987, the previous owner decided that he was only going to use that house as a 4-bedroom capacity. The dwelling was on the design plan in 1987. The dwelling was listed as a 4-bedroom dwelling. The dwelling hasn't changed since it was probably constructed in the early 1900s. And so, nowadays under the new code, people can build an 8-room house or a 15-room house in this case and put a deed restriction on the house with the understanding that they're only going to use it for whatever the bedroom deed restriction is. So back in 1987, the bedroom deed restrictions wasn't something that was part of the code and it wasn't something that was enforced. But the previous owner had decided that they wanted to have this as a 4-bedroom house. And so they chose to design it as a 4-bedroom system, potentially because that's what the soils could accept, or because that's what they intended to use the house as, and the other rooms were potentially used as something else. We don't really know. The current owners did buy this house with a assessed value of a 5-bedroom home, but the Title V did clearly indicate that the design was for a 4-bedroom system. So my recommendation would be to either deny or continue the case. The continuing option being that they could potentially come back and see if they meet the criteria for section 15.414. Or potentially just deny it at this time.
Comments, questions? So, what's at issue here are state regulations, is that correct?
Yeah, so it's state regulations, and I did run this by the state. And they agreed with my findings.
So, can you, I don't want to put you on the spot or make you say things that are considered to be in concrete, but generally speaking, what are the issues regarding seeking a variance with a new proposal that would address the?
Oh, section 414.
Yeah.
So they basically, so under the new construction definition that defines basically that if you have an existing flow, any increase off of that existing design plan is new construction. It also gives you the option of, see, I not copy and paste that in. So they say basically like, if you feel, your criteria meets the section 414, and there's a very outlined procedure of like, you have to meet 1A, 1B, 1C, and the applicant has to define those sections. Basically, it allows the local approving authority to approve the system if it meets that criteria. So it's kind of a potential pathway forward if it meets it. It's a very hard criteria to meet. When I've talked to our state representative, she says that she hasn't seen too many cases meet it, but she has seen some. But it potentially gives the option of, allowing the applicant to explore, the 5-bedroom option later down the line.
So yet another alternative is to keep it at 4 bedrooms.
Correct.
Keeping the flow the same.
Correct.
And in that case, it would not be construction, is that?
Correct.
No,
Yes.
I think it still would be new construction, where you're allowed to under 414, have that variance to the new construction. Cody is absolutely, we all want to make things better, and what they're designing is actually better protection for public health, safety, and the environment. And fortunately, this is a unique situation, and I've only seen 414 done once in 25 years. it was successful. But in a unique situation like that, this is probably the only avenue, that legally, could be done. Toby's correct. Any increase in flow triggers, new construction. And you can't ask for a, local upgrade approval, if it's new construction, because that's only for upgrades. So unfortunately, this isn't the avenue to get it done. You have to take a side spur, if you will, It's the only way I can see where this could be successful for the applicant as well as for public health and safety and the environment.
So do you agree? That's,
I agree.
Tyler, do you want to make any?
Yeah, I mean, all I could really say is if we leave it now as a 4-bedroom system that's already there, then it's gonna cause a little bit more harm to the environment. So I feel like it would be an overall betterment for the public health and the environment to install the system that we propose. I don't think the current owner should be getting in trouble because the past owner was a little bit frugal in their ways, but that's my 2 cents.
Can we speak?
Sure.
So my name is Jason Camps. I'm the builder that Rob and Jen have hired to do whatever project we propose. Obviously, this was step 1, the septic system to figure it out. I mean, my finding on it, my opinion anyway, I look at it, this house is old. It's a 17-room house with 8 rooms. Cody, John, I, and Rob walked through the house. There's clearly 8 bedrooms, 17 rooms. And with my experience, I've been in business 30 years building custom homes. We go through this process all the time. With new construction, you got to design the house for the size of the flow. So I look at whenever this was approved back in 1980 something, to me, the board made an error. The homeowner made an error. How can you allow a 4-bedroom flow on a 17-room, 8-bedroom house? That you didn't change, it's still there. I have a tough time with that, sorry that they screwed up. I think the town screwed up and the homeowner screwed up. You have a giant house there. Even if you were to renovate.
Back in the day, I lived nearby these folks, but unfortunately have never met them.
Yep.
I think back in the day when this house was built, many of those bedrooms were for staff. And staff isn't part of the issue anymore. And so I think.
But even if you look at 8, they're looking for 5, so you take that into consideration, there's still 17 rooms in that house. It's a very large house. So it just, to me, seems way off, and you look at what they're trying to do. They bought a house that has been assessed, been paying taxes on a 5-bedroom house, whether there was an error or not. That's what it's been for years.
That's neither here nor there as far as we're concerned.
Yeah.
The other thing that
Take that up with the assessor.
Right, the other thing that I agree that, it's quasi could be considered a taking if you're not allowed them to have them have a 5-bedroom house
Okay.
because they've been paying for that. But
I'm sorry,
unfortunately-
Dave, I just want to check. We have checked with legal counsel multiple times and it's not considered a taking.
I said quasi.
Okay, it's just, I just want to be sure that nobody's thinking that there's a taking here.
That's why I was very careful to say
Okay.
quasi.
Okay, good.
Let the minutes reflect that I said quasi. And people aren't required to do a mistake if they've made a mistake in the past. Otherwise, that rough weekend we had in college, we always have to do that forever in our lives. Unfortunately, that's not the case. But what I neglected to say is that even if you go through the 414 process and get the 5-bedroom, that there should be a deed restriction to make sure that it doesn't become an 8-bedroom.
Well, I think you guys are open to a deed restriction from what I've talked with Rob and yourself.
Right, but there would need to be, make sure that we don't trip over this, same regulation again in the future.
So what are you saying with that, just so I understand? Like there is a possibility for a 5-bedroom with a deed restriction?
Let me give you a copy of 414. This is the only avenue that I know that it can pass through because of this here. Which says that if there's any increase in flow, it becomes new construction and you have to meet new construction standard unless you meet the criteria of 414. And I've only seen that.
So, yeah, anything basically over the 4-bedroom count, 4 bedrooms would be assessed under an upgrade and would not be considered new construction.
Make it a 5.
5
No.
would be considered as an increase in flow and therefore new construction. Yes. Because there's an existing design plan. So what the board has seen in the past sometimes is that we don't have an existing design plan and we don't know, so we have to design for what is there. In this case, we have an existing plan that clearly states that this house is meant to be used as a 4-bedroom house, and that the system is designed as a 4-bedroom system.
So then what do you do if you were to do a major renovation on that house? You have 17 rooms. Doesn't even come close to the calculation of a 4-bedroom count.
Right, and it's very common, I mean, in Gloucester, there's many homes that are over the room count and they have to put a deed restriction in. And so if you're gonna renovate this house, you have to use it as a 4-bedroom dwelling. And it would have to have a 4-bedroom deed restriction as part of any
Even if they
renovation.
went to tear it down and build a new one, it's gotta be a 4-bedroom, but there can be additional rooms with a deed restriction,
Correct.
right?
So no, only if only if you hit the criteria.
No, they can
Still
build a
4
4-bedroom house and have it greater than 4 bedrooms by
With a deed
definition.
restriction.
With a deed restriction that you intend to use it as a 4-bedroom house. So if you wanna put, like, it's very common to
more
put your
rooms.
gym
More rooms, okay,
or
that
your
makes sense.
office or, 2 different studies, because lots of people work from home. And they wanna have their 4 bedrooms, but they also wanna have like like I said, the
Other
gym, the
rooms.
den, the other rooms. You can put a deed restriction on the house and say, I am going to only use this as a 4-bedroom house. And these other rooms, that's what these are. And basically us as the local approving authority has to approve that deed restriction, so we get to see the design plan and make sure that it does make sense that those rooms are gonna be offices or gyms or dens. And then, down the line, if those owners sell it, the next owner can't come in there and
Right.
just turn it into an 8-bedroom house.
Just know every town's kind of different with the deed restrictions and what they allow. That's why I wanted to just make sure I understood.
I mean, that's working off of state regulations, not our local regulations.
Yeah.
So that's an option, and then it's if we meet this criteria to be able to have a legal 5-bedroom.
Correct.
Okay.
Everybody really wants it to be upgraded. But unfortunately, somebody that has more authority than us has written regulations that make it very difficult to sometimes do what's right,
No, I get it. Believe me, I always look at the common sense factor of the size of that house, the amount of rooms. It just, to me, makes no sense, but I'm not making the rules.
Sometimes people write regulations don't have windows to the outside world.
Yeah, yeah.
So Cody, have you and Tyler at all talked about?
We haven't
these
talked about moving forward with 414, so that's kind of up to Tyler. I mean, we could continue it and he can talk with his clients outside of it and let us know if he wants to on the next hearing,
Yeah,
if they wanna bring it back. And if you guys don't wanna explore the 414 option, the board can make a vote on it.
Yeah, I mean, I think I wanna learn it more before we make that decision, right?
that's what I would recommend doing that rather than.
So, yeah, so it would be a continuance in that case.
Right.
And Tyler can let us know when he wants it to be continued to, on what meeting we wanna put it back on.
Right.
It sounds, yeah.
So I think you have to make that move, Tyler, if that's what you
Yeah,
feel.
yeah, I mean, does that sound like a plan to you
Yeah,
guys?
sounds
I
good,
think
yeah.
that's the best way forward.
So does there have to be a motion for that, Joe, or no?
I don't know.
On a continuance?
But let's
No,
speak-
I don't
You can
believe
just
so.
withdraw.
Is it a withdrawal or a continuance? I think it's just a continuance, right?
I wish I had that answer for you. Typically, you guys would withdraw and then come back and resubmit.
I've only done continuances, so then I'll leave that up to you.
I'm sorry, I don't have the answer.
Well,
Should we-
there's no prejudice either way.
Yeah, either way, there's no prejudice, so.
So.
Okay.
As opposed to having a vote, then have something
Right.
probably negative against you,
Right.
which wouldn't help. So,
So,
So we'll just do it as a
yeah,
continuance.
yeah, we'll keep in
Reschedule.
touch about this.
you know, by all means, talk to Cody.
Yeah.
And maybe involve Dave in a meeting. Dave knows all the, where all the bodies are buried.
Yeah, all right, sounds
Okay.
like a plan to me.
All right.
All right. Thank you, guys.
Can I take it?
Thank you.
What is it that you gave them?
Just a printout of Title V.
Of 414.
All it is a regulation.
If they have a look with
I just wanted, I mean, because something you're not a board member, I just wanted to show the way.
Me and Dave met beforehand and he's the one who showed me the printouts, so I know that that's what he's
Okay,
handling.
perfect.
He was made on the breakfast. Club.
Yep.
Good luck.
So we're on number 7. That's all.
All right, thank you, everyone.
Bye, Tyler.
Thank you.
That's it.
Okay, I'm flush with excitement.
Thank you, Dave.
Dave, thank you for coming
Thank
down.
you for your help.
Appreciate
Yes,
it.
thank you.
And Eric, your name tag's turned around. Your name tag's turned around. Your
It's
name
looking
tag
at
is
you, your
turned
name,
around.
so.
Yes, there you go.
The next item on the agenda is now item number 7, approval to pursue the Public Health Excellence Collaborative, Cape Ann Public Health Alliance. And Dominique. the
So on
director.
your desks is there's a link obviously in the packet that gave you the full application that reviewed the state guidelines, it's everything that's in front of city council today to accept. Before us today, however, is a request from our legal department that the board formally vote to allow us to work with the town of Manchester by the Sea and form what's called the Cape Ann Public Health Alliance. That's specifically what's before us because in order for the legal team to do what they have to do, they need the board to officially vote on that. So I'm happy to answer any questions that you may have on the grant of the grant process. I know we've been talking about it for many months. But that's why I've printed out the excerpt in addition to what you have, which is literally the application form that went to the state with our rationale for what we're doing and why. And again, the organization name, which will be called the Cape Ann Public Health Alliance.
So we've heard about this multiple times in the past. And as far as I'm aware, the monies have been granted. However, we cannot access them until we have this agreement. And so I would certainly argue that we approve this proposal and ask that the city, whoever in the city is responsible for letting this happen, legal department or elsewhere, expedite the process as quickly as possible, because my understanding, Dominique, correct me if I'm wrong, my understanding is that there's a certain fraction of the money that has to be spent by the end of this calendar year. And the calendar year is drawing closer and closer with each passing day. So the sooner we can get this done, the better off we'll be.
Yeah, there's $300,000 in this calendar year available to us to work on the things we want to work on. And the state's going to prorate that for every day that goes on. We'll get less and less in this calendar year. And so this agreement for you all to say, yes, we want to form the Cape Ann Public Health Alliance, which means that we'll be working in concert with Manchester by the Sea to form this collaboration, will allow our legal teams to help craft an intermunicipal agreement, which they feel strongly should be done in advance of us accepting the grant. a little different than the rest of the state, but it's how our legal department wants to operate and how our administration wants us to operate. So that's what we're going to do. And so in reviewing that process, this came up that the board had never formally voted on forming this named alliance. And so that's what we have to do right now as the next step in moving that forward.
I know we got to meet Wendy as part of our previous events back in the spring, and I think it's a phenomenal opportunity. So without wanting to waste anything else, I would make a motion that we approve the creation and formation of the Cape Ann.
Any discussion, further discussion?
Sounds great.
Vote,
Erin, yes.
Joe yes.
Eric Campbell, yes.
Thank you.
Okay, less money flow.
Yeah.
True to Campbell.
So there's nothing more on that, right?
Yep, that was it. That's what we needed to have done.
Next item on the agenda is the discussion and approval
I'm
of.
sorry, Mr. Chairman, I wanted to let you
Yeah,
know a next
sorry.
step here, though, that's important. So when this is now, sent to legal, they now know that you all have approved that, then they're going to be drafting an intermunicipal agreement between our two towns. Manchester by the Sea, both their selectmen and the Board of Health has already edited a draft intermunicipal agreement, which is fairly boilerplate, that sets forth the terms of how we govern and operate between the two towns. Our legal department has that red line, and then they're gonna redline, and then I'll give it to you from there. So you're looking at everybody's comments and you can make your final choices. So I'll be coming back to you, and I might come back to you off cycle and ask you all to have a look at it and submit your comments, and then perhaps we can, have a quick meeting to get that, to not wait a whole nother month before we can move forward with that IMA.
Hopefully we don't
It should
have
be
to go
expedited.
around,
Yeah,
go around in circles
exactly.
with visions.
Yeah.
Um,
Okay, sorry.
Okay,
So, are we ready to move to the next agenda item?
next
The food?
agenda item is the food violation escalation protocol.
Okay.
Sounds very.
Very official.
So I'm going to be, talking through this protocol. Have you all seen it? And have you had a chance to look at it? And, okay, you haven't. So then I can also share it and we can review it at the same time on the screen. What we're trying to do is, as you know, the Board of Health operates as an agent of the Department of Health operates as an agent of the Board of Health. And that means that we're acting as you, as if the board had said to do something, we have the authority to go out and demand the same. When it comes to food inspections, particularly in our community where we have most restaurants experiencing violations when we inspect, very rarely, if ever, do we have somebody getting a no violation inspection. And so most restaurateurs are working wonderfully with Sophia, who's here to help add some color and answer any of your questions. But the challenge that we have, and Sophia, asked me to bring this up with you, is we really want to review with you our path for escalation. So from the first report to a reinspection to, ongoing non-compliance to the point where we have to really consider shutting down the restaurant. And we'd like you to hear us out in terms of those stages and then make a vote that we can act in this manner, that we are appropriately escalating it to you at the right time, and that our approach is amenable and also moving in any direction you want if it's not. Does that make sense?
Yeah.
So I can share it with you.
I brought it up.
Oh,
You should,
bigger?
That I
repeat to the
can.
board what you and I discussed that I've forgotten about the fact that this is not a local regulation. This
Thank
is
you.
enforcing state regulations,
That's
but
right.
in a particular way that we're gonna talk about.
That's right. So what, in all cases, Sophia, when she's inspecting, is representing state standards for food code. And most of the restaurateurs work comfortably with us to correct. What we're looking for is not any installation of regulations. We're just saying that this is the handoff point between the health department and the board and making sure that we're acting appropriately as your agent and that we're escalating appropriately. Does that make sense? Does that clarify it? But there's no new regulations here. Anything that we're doing is in support of the existing state regulations. So just to start at the top, and we'll go fairly quickly through this, but just to be sure you have full understanding. In general, we want to be sure that we're providing due process, that we're being clear in communication, that we're operating consistently across all restaurants. that we're staying focused on public health. There you go, scroll a bit.
Sorry.
That we are making sure that inspection staff are always trained in this protocol and relevant regulations and can act accordingly. And that we are, always keeping comprehensive and accurate records of all inspections. So those are in general, as we look at this is, sort of where we're coming from. So what we have here are four key areas, 1 through 4. And the first one, under section B, we call it is what we are able to do to act, right? So this is us clarifying. So Sophia walks into a restaurant, she finds violations
Sounds
during
like the
the.
beginning of a joke.
It can.
Yeah, that's my life, unfortunately.
Sophia walks into a restaurant.
And Loach comes out and says, hello.
Nice, big surprise.
Actually, we very rarely do surprise. In fact,
Yeah.
we're just starting them because
Exactly.
we had to set up appointments so that we could actually help our restaurateurs be prepared. Because there were so many violations and misunderstanding of the food code. So she walks into the restaurant, she finds violations, right? Her action at that point, and we have a software program that does this, called Food Code Pro, is she issues a written inspection report to the restaurateur that she is completing while on site, and or leaving shortly and coming back and having the restaurateur review it with her and acknowledge it with a signature. It details specific violations, it cites the relevant regulations from the food code, and it requests a specified time frame for correction. And that time frame for correction is based on the severity of the violation. And if we scroll down to table figure 1 rather, Cody, just a little bit down, we'll come back up there. So if it's a priority, the correction timeframe is within 72 hours of inspection. If it's a priority foundation, it's within 10 calendar days. And if it's a core, it's within 90 days. In some instances, if it's at risk of, causing imminent health and hazard, she can require people be turning this around in 24 hours.
Or immediately.
Or, yeah, she oftentimes does, like all of this food must be thrown out. It's not date stamped.
Suspend, they can't work.
No, that's not the case. It's more of the fact of, when I'm on an inspection, if I'm seeing priority violation, something that's directly contributing to, it's a risk to public health, immediately we need to turn this around. I'm 9.9 times out of 10 not gonna leave until that has been corrected immediately, unless for some reason it can't. Which may trigger,
A rodent infestation. as
yeah,
an example.
exactly, like that's not gonna be fixed immediately. And so, yeah, just.
But
depends
she's
on what I'm
adamant
seeing.
about making sure that whatever can be corrected on site right at that moment
It's
is.
done.
For 2 reasons. One, to make sure it's happening, and secondly, so that the restaurant can stay open, right? Otherwise she would have to
Escalate.
make a decision, which is what happens when you have an imminent health hazard. And that's when we're going to issue a summary suspension. That's not a permanent suspension, it's a suspension until you correct. It does not require a board hearing. And it requires the establishment to cease all food prep and service until they've fixed what she has called out in her report. So that's the first set of requirements or actions that we would take. We record that inspection report in the establishment's file. We get the operator's signature on it so that they understand it. Sophia, I've done it with her a couple times, and she spends time reviewing exactly what's happening, demonstrating, repeatedly trying to get the operator to understand what has to unfold in order for the criteria to be met so that it wouldn't be a violation anymore. And then she'll schedule a reinspection at that point within a specified time frame, right? Because there's a period of time that they can correct. And so that's the first step that we take. We do say at the bottom of this that we'll have extensions to correction timelines. If they can let us know how and when it's going to happen, there's an outstanding circumstance that might require it. So that's an easy one, right? We just go in and inspect, they have to fix things.
And then we schedule the reinspection, and usually it ends there.
Right, and we come back and everything's looking great. But now let's pretend that it doesn't work out that way. Okay, so she comes back and they failed to correct the violations. So she came back in 72 hours and still finds violations where a reinspection report has to be issued. And at this point, we're gonna generate an order letter of required action. So we get a little bit more official now, rather than the report itself that serves as the requirement. Now the order letter is being generated. Any violations noted in the initial reinspection report, or if we find new ones, which has happened, we will again generate the same inspection, and again, review it with the restaurateur or the operator and have them sign it and commit to it.
Can I just interrupt?
Sure.
Sophia, I'm sorry. From your experience, is that second inspection failure, is it due to them just blowing you off? Or did they try to do something and they just didn't do it right?
So the reason this is coming up today is because I had my first experience with going to a reinspection and still finding things are out of control is how I would call it. It's usually a mixture of various factors. But it's all a symptom usually of the fact that there's no active managerial control. So the person in charge does not have the knowledge or wherewithal on what risks are even present. What I'm calling out, it didn't even occur to them that this is a problem. And even when I do call it out, they're unaware of how to correct for it. So this is all a symptom of a greater issue where people aren't able to sustain a safe food establishment.
You were
So
about to
there's
say,
no, if somebody buys a restaurant, an existing restaurant, is there any process that they have to go through to show that they know what they're doing?
So that would start with the plan review process, which every new establishment, change of ownership, or even renovations have to undergo, but it's more important with the first two. We highly recommend that they work with a food safety consultant from the beginning to submit a plan and show an operation, a menu, a flow that is going to be in compliance with the code. That's a great opportunity for us to discover any deficiencies before they open the doors. And
But
they're
is
not.
there any requirement that they even talk to you?
Oh, yeah. We will not issue a permit until they have been approved. Their plan review application has been approved.
And that's not the day before they want to open?
No.
So can
Months
you
in
elaborate on
advance.
how you're working with prospective buyers?
Yeah, absolutely. So I know we've touched on this in the past because when I first arrived on the scene here, the plan review process hadn't been a thing, even though it's in the code that it must happen. So we were really catching people off guard, and it was really frustrating both for the new operator, even existing ones, and for us. So what we've done is tried to proactively, if we're out and about in town, we see a for rent sign, we hear of something going on, we're getting in contact with whoever we can get in contact with to make them aware of this process. We've been doing that for over a year now, to the point where we have people contacting us. So word of mouth has worked its magic. People are contacting us to start that process.
So they do a pre-walkthrough and
thank you.
then call out,
Forgot about that.
what are infractions that need to be attended to.
Yeah, so with a
That-
courtesy walkthrough with the building commissioner, because there may be existing building, fire, electrical violations that he may be able to identify, but it's a really
occurring.
yes, exactly, well-received courtesy that we extend to people to help them understand the financial implication, really the financial implication of what they're walking into, because there's a huge cost associated with needing to come up to 100% compliance, especially in the state that a lot of these establishments are in.
Let us know what the restaurants are that are having particularly this one.
Are you the one that I'm dealing with?
Yes.
So it was fishtails that triggered all of this. And I had never I've experienced plenty of times walking into a restaurant and they really had no idea of their responsibilities. So I've tried my best to be as helpful as possible in educating, staying on scene for hours and helping them fix everything and really understand. But this was an instance where from the beginning, there was a indication that they didn't understand what their responsibilities and duties were to protect public health, and every
have the staff
subsequent,
either,
couldn't keep good staff on hand. And it's been a historical issue of non-compliance, unsafe food practices. So this was my second routine inspection. That was a failure.
I always was under the impression that at least one person in the place that's making the food has to take a course.
You're right. You're right.
So they obviously didn't do that.
Right. Exactly. And that course is only as good as your retraining is on those. I mean, you take that course and it's good for 5 years. It's like school. You study for the test and then forget everything afterwards. You remember? I do. But are there sustained actions in place where they are doing their duties?
I was wondering
Training.
why it's hardly ever open.
Yeah. So that's why we're here today. Because not only was the inspection a failure and things were completely out of control where I felt like I needed to close them on the spot, but the 2 re-inspections in the week were also huge failures, and even more serious violations came up at those, despite them being closed. So
We'll say the report that you give after doing a routine inspection, I think is really comprehensive. Like there's actually, having been able to see one of them and have follow-up items, like you make it very clear, like there's pictures in it of like what the specific issue are with like follow-up items. And I can speak to knowing that Sophia has been very helpful to people that maybe it isn't necessarily a restaurant or something like that food service isn't the primary objective of the joint, that she's done a really helpful job. So I think, to me, it seems like the information, even if you don't have a restaurant background, is a
Right.
layperson is spelled out very clearly. There's pictures, she's doing stuff on site. So I think if even with all of that and your support, there continues to be issues, that would be really concerning.
yeah, no, exactly. Thank you. And there's a bigger issue in these instances. Sometimes it is just a lack of caring, but which I see sometimes. In this instance, I feel that was part of the case, but yeah, just the knowledge isn't there in order to run it with a safe place and for me to be able to sign off.
Thank you. So in that moment, here we are on this reinspection with this, this environment. We still have violations. We are now stepping up to generate an order letter as well as that inspection report. And the order letter is going to clearly state potential consequences such as fines, which is where we'd like you to weigh in. Suspension of a permit, not just a temporary suspension, but a permanent suspension, or even legal action, where there's moments where, and we'll talk about that a little bit later in stage 4, where, we would actually move beyond the Board of Health at that point and ask our legal counsel to step in. So the health inspector, of course, at this time can impose shorter correction timeframe. So maybe it was 72 hours before she's come back. It's by tomorrow. If not by tomorrow, here's what's going to happen. Again, we send out the report and with an order letter, and we'll send it by certified mail now so that it becomes, official record. And prior to this, by the way, the reports are emailed. They're not mailed out, they're emailed to the provider. And then we'll schedule another reinspection. So at this point, this is still us doing this work. When Gabby and I were meeting about this as well, we were thinking perhaps at board meetings, we help you understand where people are sitting in the equation. Like, what's our volume of people that are at step 2? So you get a sense of the ecosystem and what might be coming before the board. We could perhaps tell you about these reinspection moments. So you are sort of up to speed on them. You're not sort of blinded by them if you're interested in that. So that's something that we'd like to hear more about.
I'm very interested because I know which places I should be.
Yeah.
But you're acting for the greater good of the whole community now, Erin.
So level 2 is
yeah.
basically is making it a serious issue as opposed to
We'll still shut them down.
Sophia's going in.
Yeah, if we're at 2, I'm still not getting what I need, despite laying things out for them, establishing deadlines, just establishing exactly what needs to be done.
So now
thinking about things at that level is probably a good place to start.
Okay, great.
Okay, we'll be sure that we do that. So now the applicant is, has not done what we tell them to per the order letter. And now we're going to bring them before the Board of Health. in a hearing, again, question for you, special hearing or next board hearing. We think they would be shut down until that next board hearing. So that's situations where the violations remain uncorrected after the order letter timelines have passed. Repeated violations are observed from multiple inspection results. In other words, it could just be a chronic person who routinely may be fixing things when we're there, but the next time we inspect, it's the same thing all over again. Or even in stage 1 or 2, the operator disagrees with us and requests a hearing, which is their right from a shutdown. So in those moments, we'd want to bring them before you. And your actions then are to impose fines for the code. And we have established fee schedules that are connected to the same for uncorrected violations. I think it's like per dollar per day, per infraction per day. Is that correct?
We do have a table that states that in here. No, we have too many tables. Okay. Nothing per day.
So
I can go back and
Okay.
confirm that, but
So you would have the right to, per the code, to impose a fine. You could also impose a temporary suspension, as we have. Again, you can keep them closed or decide to reclose them. And then what we'd like to propose is that you also consider requiring them to hire, the operator to hire a food safety consultant. Now, this isn't in the code, but we found it to be very effective. We've had a few restaurants in town that were struggling like this, but wanted to get things right, but they just couldn't. And hired a food safety consultant. And a food safety consultant comes in and works with the restaurant operator directly. So instead of Sophia being that person, an outside party is paid for by the restaurant. They work with them for 6 months. They do the surprise inspections. They give them reports, review what they did wrong. They send us those reports so we can track against it. And it helps Sophia know that they are building their understanding of managerial control. It helps the restaurant be successful in these inspections and have not a lot of work to do. And so I don't know if you want to give one example of one. I don't know that you need to name the restaurant. It's a very public forum.
yeah, sure.
but,
I mean, I did have one where we had a poor inspection and I was teetering on the line of whether I felt that it was okay to let them continue. So that was an instance where I say, hey, shut your doors for an hour or two. Let's focus together and get this under control. And the operator and the staff took that very seriously. I made the recommendation that they hire a food safety consultant and they went out and did it. And I didn't even know that they had done it until I got a call from the consultant asking me to come down and do an inspection, my own inspection with her and everyone involved. And they knocked that inspection out of the park. They were they were thrilled with their own performance. I was thrilled to see that they'd taken it so seriously. And it's just a great example of what can happen when you bring in these people. Because a lot of the times the problem can get so big and out of control that they don't know where to start. So that those outside eyes and ears really help.
And we would rather you do that than impose a fine, frankly, because, a fine is punitive, but it's not getting us to the solution. A food consultant will get them to the answer. So that's, we would like it if you all would help with that.
Do you have any idea what order of magnitude dollars or?
I actually don't. It is expensive, but so is a fine, especially if they are getting stacked up over time. But I think here is the value that you
Sure,
get from the
yeah.
food safety consultant. It's and it's expensive enough to where you aren't gonna want to do it again. It's expensive to have your reputation tarnished by.
It's a business
Yeah,
expense as well.
exactly, it is.
Yeah.
So it's, the pros and cons and invisible costs that come with maybe not hiring one.
So then again, with documentation, we would keep all hearing records as we always do. Any fine notices, we would do all Board of Health orders. And we would send a letter out, again, certified, mailed to the operator of any of your board voted decisions, right? We would also monitor and re-inspect as defined by your guidance. So at this point, you all are stepping in, right? So we've hit a point where we're not being successful. We want to bring them before the board and have the board, offer those requirements. Okay, so now they still haven't acted in stage 4. They've not demonstrated compliance to the board ordered requirements. Their food inspector reports don't demonstrate the lack of active managerial control. And so,
So is there, in the meantime, before you get to that
Yeah.
point, they've been fined, say, or they've been asked to hire a consultant, and they haven't done that.
that's right, here we are.
I think that this can also apply to historical, like every inspection, not just they're going through this process from one inspection, but also, I go back every 6 months or so and it continues to be an issue. I can see stage 4 being.
But
that's
they've been fined and they're paying the fines.
Yep.
They,
Presume if it's at that level, they've been shut down. Is that? Well, they're probably not paying a fine.
That's stage 3.
Well, if they're, every time she goes and you fail them, every time that keeps happening every 6 months, would that be considered chronic
Well,
non-compliance?
I can only keep them closed
Yeah.
as long as
There's
they're
the issue,
outstanding
yeah.
violations. So I can't keep them closed indefinitely. I can't, once they make the corrections, you may reopen once we've seen and documented that you've made all those corrections. So I think to your point, again, it's a more of a historical thing here.
So I guess I'm just trying to think through if they come before the board, step 3. And we fine them.
and of course, you'll have other parts of that. You'll say, you must do this, you must do that. Or we can revoke your permit completely.
Okay, so that's it.
That would be step 4.
They just pay the fine. Go off and open the doors again. That's.
Yeah, I'm guessing it would be more complex than that. You would have a set of recommendations, and just like we do in all situations, we would have a recommended path for you in the briefing of what we believe to be appropriate.
Along with all the history and reports. To get the whole picture at this point.
Yeah. So now here we are, they haven't done what you've told them to do. And at this point in time, your actions are that you can, again, impose any of the actions you've already done in stage 3 in section C1. Again, you could, fine them again, you could continue fines, you could continue suspension. Or you might, in an egregious moment, revoke the permit revocation. And this would involve working with our city solicitor, because you can say you can vote to do this, and then that would trigger actions working with our city solicitor on how that unfolds. There might also be a referral at that point to legal counsel for civil or criminal prosecution, cases of fraud, intentional misrepresentation, or severe public health endangerment. And again, this is all coming from food code. But these are the things that Sophia would not be implementing. This would be before you all, and you would make these choices. And we would then engage with our legal counsel. And as before, all documentation related to closures, license suspension, that should say permit suspension, forgive me, and legal refers, it has to be meticulously maintained. So we don't license, we permit. The city provides a victualler's license, but we only provide the permitting. And again, we would follow up. So at this point in time, this is now escalated. This is like the Board of Health has put a note on the door saying you are closed. And the operator needs to make some choices as to whether they're going to comply at this point or, and we would have legal counsel supporting how those actions unfold. So in the rest of the document for your edification are definitions of immediate health hazards and all other aspects of the code that are in this document. It's on tabs in your folder, so you can read what I have here, but then you can click on each one of the other tabs and look at further detail of the food code for your edification.
So is this from your understanding of what goes on in other communities, is this typical of what goes on in smaller cities or bigger
So
cities?
the food, so with the exception of the food consultant, it's what is required by the code. So I would hope so. I know, of course, Gabby's ill today, by the way, which is why she's not here. I forgot to tell you that. We miss Gabby. But when Gabby was, Gabby spent a lot of time on this. She was trying to bring, simplify it as much as possible so that we are attending to the code and helping not be punitive to the operator, but supportive, but really, having it be a very clear path. So the food consultant is not required. That's the only piece that's not directly out of code guidelines. In the code, it basically says if we were to want to shut down, you have to appear before the Board of Health unless there's an imminent health hazard. And so we're doing the same thing here, right? So if it's an imminent health hazard, we can do the temporary suspension. If you want to permanently suspend, that has to come before the board. So it's just you all saying, again, what we're looking for here is more just you agree with us that we are operating appropriately, that these are the right points of escalation to you. What I've heard so far is that you'd like to have a status on how many number twos there are, right?
Yep.
Or even how many violations, right? Like where are we sitting? We'll provide a briefing for anything that's hitting to a hearing when we make a pass for a hearing. If you'd like, we could also bring any twos to you to say, we want to push for a hearing on this one and you can agree. If that would be advisable, you could also offer
I
counsel.
think in cases where you'd like some extra information or opinion,
Yeah,
sure. But I wouldn't necessarily make it a mark.
okay. Typically, we keep the operator's name out of a hearing of the Board of Health meetings because they are operating in good faith and it can have a lot of impact on their business and if they're operating in good faith. But in these moments when they come before you in hearing, that's public hearing.
Yeah.
And so now the name of the organization's out there as part
That
of our
should be
agenda.
part of the deterrent. Your name is gonna appear
Yeah,
in front of the board.
and public discussion on all of the infractions on your business. I don't think any operator would want to be in that room.
Right.
And that's, again, part of the letter writing in stage 2 to say, one more chance here on reinspection or you will be brought before the board.
Good.
Yeah, that accurately reflects also what I was looking for, a clear framework so that I know I'm operating consistently.
So I don't know that we need to vote, but can we all agree that that's how we're going to operate? Because it's not a voting matter. It is already the law. It's just a question of you all saying, like, as an agent of you, that you agree you're aligned with this, this escalation program.
No, to me, it makes complete sense, and I think it's more than fair, especially understanding like the process that you go through and things and stuff like that.
Yeah, there would be a lot of action.
Yeah, I was gonna say
to you
before, yeah.
on my end.
Because it seems like we've only had maybe one conversation before of a place that was having issues and struggling and stuff, so it seems like most people are able to take the feedback that you get them, so this is really those situations where you're not getting.
Exactly, where I need support, essentially.
Sounds good.
When I was on the Board of Health in Chester, we went over all these things.
Did you? I think it's helpful for
We had
everybody.
A lot of restaurants.
Yeah.
Yeah. I do have just a kind of random, kind of correlated question. Because I'm just thinking about like some restaurants, a lot of the profit driver is their liquor license. I know that's all through ZBA, but there's no connection that you have with my, I was just curious.
No, if they can't, you see, what I don't know is if you can't, if I shut you down, you still can't operate your bar. That actually did come up with the operator at Fishtails. And I'm pretty sure that the liquor board requires you to be serving food in order to serve alcohol.
Yeah, I just was, just in terms of other motivating
Yeah,
factors
right.
that might help people understand why.
Right,
this is
the
important to
total
do, whether-
limitation,
yeah.
right. Right.
All right, so is that
Good,
a
yep.
unanimous yes?
Thank
Okay.
you, Sophia.
Awesome.
Yes.
Thank you.
Thank you, Sophia.
Thank you.
All right.
Health director.
There'll be one more before that, I believe.
Oh.
Yes,
Rental registration.
rental
Sorry.
registration. And so as we say, in that section, a letter, and Bree's online as well, if in case there's any questions, so maybe you could promote reading the panelist.
She is.
Okay, oh, good. A letter went out to residents, it was supposed to go out earlier in the summer, but we dropped it bulk to be efficient with cost. And unfortunately, it's staggered through delivery cycles. So in some cases, people had 2 weeks and some people got their letters after the August 1 deadline. The August 1 deadline, in the letter, we said that if you are not registered, you are, there's a fine up to $500 per infraction per day. And people are very concerned about this because the letters came late. And so it's in our requirements that you register or you can be fined. And so we propose that we move our enforcement date to November 30. So we can give enough people time to get in, get registered. There's a lot of confusion because we're asking for consistent information for both short-term rentals, ADUs, everything, which is fantastic for the city to have one version of the truth for all rental properties and helps everybody from fire to building to health really work well from a health and safety standpoint. But it's taking longer. And we will talk a little bit about our numbers when we get to that portion of our meeting. So we'd like to move it to November 30 for our enforcement. Of course, unless we find something egregious, and we bring it before you specially. But after this date, any resident who's renting without a rental registry, as per our regulations, will receive a warning letter, right, advising them that they have to register. To apply for the registry, and if they don't do that, within 10 days, they'll get a letter demanding this fine. And so we don't know that unless you'd like us to, we would bring it before you. We would just act in that manner. And so we want to, review this enforcement protocol with you and make sure you're okay with that. So again, that we can act as an agent of you and that you're in alignment with our paths.
Yeah, I certainly agree with that. That's the way it should be.
Yes, no, any questions?
Since I have a rental property, I'm gonna make a comment and
Oh.
I've registered, I have registered.
Okay.
My wife is the one who pays the bills.
Ah.
She didn't know where to send the check for $30.
Oh, interesting. It doesn't say.
I gave her the information. She said she couldn't. She
Okay,
didn't
300.
understand where it was supposed to go.
Okay, thanks.
I can give
take
you a
note
check
on
for
that.
$30 right now. So I get to know where it's
Take note
supposed to
on
go.
that.
But
Okay, well, there's a lot of little twitchy bugs in there because we're down an app engineer in the city. We're actively trying to find one. But our IT organization really stepped up and tried to make all this come together. There's still some little glitchy things going on, but they're working hard on it. So, but are we in alignment?
No, I think that makes sense, and I think it does take some time to go through, so especially property owners that might be having to take some time to go through, make sure they're understanding, and when they sign that they're freeing and their properties are up to that standard, then hopefully they're doing those things too. That makes sense.
Yeah. Okay, so that's the end of that one. If you guys are all in alignment, then we're pretty, okay, wonderful, thank you. Okay, now healthcare director's recap. A lot has gone on. I actually took some time to write it down because so much is happening. First of all, I just want to publicly thank Gabby for the time I was out on FMLA. She stood up and did my job and her job, and a lot was going on during that time. And so my arm is it's fine, achy. It's fine. Thank you for asking. It's better. I got an A+ today from PT. They said I'm doing remarkably, so that's great. Thanks for asking. So I just want to say, no, she's not. No, she's really under the weather.
Well, relay our thanks.
Will do.
She was stomping the streets yesterday, the day before, it was by action for something, it was like all over the ball, following up on stuff, so very clearly.
She's
Getting after it,
Yeah, she was. And one of my updates is on the seaweed. She's like been water testing and not feeling well, and so I think it's all hit her, and she's just resting and trying to get better. So thank her. The next one is I wanted to update you all on emergency preparedness. There's a cross-city team that has formed that's been assembled to work together and tie into regional emergency management planning. So we're working now on a comprehensive emergency management training documentation so that all city departments are looking at what we call the SEMP, the Comprehensive Emergency Management Plan. And the health department has specific things that they're accountable for at a state level that we'll be attaching in there. But what's great is that Colin Buckner, who's works from the fire department, he oversees this. He's really taking the lead on this, and I'm excited to have the collaboration across all the departments, for us to work on emergency preparedness. In other news, I took the Title V System Inspector training in July, so that I can be helpful to Cody as time goes on. And I'm testing this month because of my surgery. I couldn't test with the rest of the class. I'm going to be testing shortly, I think on the 18th of this month or shortly thereafter. We are working with the Medical Reserve Corps to set up focus groups on access.
That door,
This next one?
yes.
To set up focus groups on access for mental health care, access and see if the role of volunteer corps might be able to play in speeding up access to services for emergency moments. So this actually, Erin, you and Peggy had brought up this challenge, and we keep thinking about it. There's two big things that we're facing. One is navigation across services, and the other is rapid access to mental health care. As two big drivers in the city where there's gaps in care and access. And so in speaking with Lisa Jackson, who runs the Medical Reserve Corps, they have several certified and currently certified psychologists and social workers. And so the idea is that we just want to explore, could we set up a volunteer corps that could help solve this, problem in the interim? We don't know. I'm happy to involve you, by the way. If, or any of you, if you'd like to. And we just want to start listening and seeing. We're asking them questions such as availability of volunteering time, billability, because even though you're a volunteer, you might still be able to bill through your insurance programs as a provider, and just explore what the moving parts might be to see if we can act that. Lisa Jackson from MRC is very excited about it. She actually talked about it in a all region emergency planning session as something that's pretty progressive, and she's excited to get working on it. Cindy, you want to add anything else there?
No,
Cindy's
but
working with this
one
too.
thing we were looking at was if the volunteers were more comfortable with like a virtual appointments, or could they be present?
Because we feel present is important.
We do, but many of those people are not from really close by, so they may be virtual appointments.
Yeah, and again, this focus group is really to get a sense of how it might operate, not necessarily to say these are the people. Right, it's just to bring that subject matter expertise into the room. The RISE grant, which is our opioid abatement program that is being matched by the state, whereby the city put in 100,000, Rockport put in 30, Ipswich put in 20, and then the state matched it with 150. It's been delayed in deployment because we're waiting for the city to draft intermunicipal agreements between the parties. We've been doing some great work getting memorandums of understanding and terms established and how you're going to operate. So once these funds are released and available, we'll be able to move forward. This is another example of everything that has to get done by December 31st. So here we are, mid-September, we have 1 quarter to spend $300,000. Also important for you to know is that I think in September or October, we have to apply for the next renewal of this, right? And so we have set up a lot of operational process. We have defined services and how we want to operate, but unfortunately, getting the money out the door has been difficult. And we're working actively with the administration to see what we can do to speed it up.
Are you gonna be able to spend the $300,000 this year? Or whatever.
Sadly, it's a big problem. Opioid use disorder is a big problem in our community. We think there's no lack of demand. The majority, about 50% of our funds is going to Core Peer Recovery, who will be providing sober house access. They're already set up, they're already approved, and we have the RISE match dollars releasable. So that's at least 50% of the dollars that we can get rolling. We're uncertain because we also have to promote it, and we can't promote it until we have approval to run it. So we're sort of in a catch-22 right now. Other communities have said, oh, let's put in Narcan, Narcan facilities. And we're taking a different approach. We're saying, let's holistically look at what we can do to change the dynamic and treatment the continuum of treatment. So we don't have gaps in treatment, so that we can have somebody move from treatment into recovery pretty easily. As a reminder, we're doing transportation, copay assistance, sober housing, sober programming, and adding recovery coaches to the region. So all focused on how quickly we can get people the help that they need and get them as far as possible through the continuum for success. It's a little different than putting in a Narcan. So it's not tactical, it's more strategic. It has more arms, but it's more extensible and more scalable. You know, it's like the right thing to do so that when more money comes in, it can keep rolling. It's just been pretty difficult to get everything going on. We've also been plagued with things that, you know, we thought Addison Gilbert would be our copay offset, and now suddenly they couldn't do it. So we found another pharmacy, they have been unresponsive. So now we're working with Needy Meds, or we thought we could do Uber Health, but the city's not willing to sign the contract. So we thought, okay, we'll work with taxi companies, but the city doesn't want us necessarily running the taxi. So now we're trying to find a nonprofit who could actually, you know, run the taxi. So there's a lot of new things here that we need to align with the administration on. And I understand their hesitancy because, you know, what's the role of the health department? How can we sustain this? I get it. So it's been a little bit more difficult than we would like it to be. Chelsea, you want to add anything there? Chelsea and Lacey are working actively on this.
Yeah,
as
so
well.
I'll give Lacey Natty, who's our program manager, all the credit on this. She's her role is split between managing the RISE grant and managing our prevention and early childhood grant, which is like a very different scope of work, but she has the skills to do both. Some weeks that there's been a lot of hurdles and unexpected changes, but we have really strong community partners who are really like willing to step up to the plate and flex and change and pivot to meet the needs of the community. So we're very grateful for that. And yeah, I do think that the silver lining is like the match dollars, the 150,000 that's not held up with the municipal money can be deployed.
Right.
So like that's going to core peer recovery, to support those recovery housing stipends, to support their expanded recovery supports. And it really is, I mean, there's like examples of something happening this week where our client needed support getting transportation, which that need, but getting staff support around getting from where they're currently staying to a treatment and recovery facility. And they are able to walk, I guess, journey with them throughout that recovery process. So core staff are really like sitting down with people, coming up with a recovery plan, driving them in their van if needed, providing social supports to keep people, to help people stay on track in their recovery plan and tailoring it to their needs. So it's really nice
They've
that
done a
it's,
fantastic job, yeah.
it's like, so I'm very grateful to all of our community partners for like their dedication and like riding the waves of this process.
Yeah. And the state is understanding about operational setup time, to a point. You know, again, we have to be able to reapply and we haven't spent anything yet, so it's gonna be hard to make that case. But we remain optimistic because it's very important.
Yeah.
And we're in fact meeting on that creative side tomorrow. I'm participating in a data advisory committee for the state's platform for public health excellence. And really great things that I've been pushing actively for them not to create a platform that would overwrite everything that we're doing in municipalities, but instead operate with the technology system. So as an example, I introduced them to the CEOs of OpenGov and Relevant Systems, and they're now working on integration so that we can not lose all the collaboration that we're doing, but also take advantage of the technology that the state is bringing forward. On your desks are from September 17th from 10 to 12 at Beverly Hospital is the Addison Gilbert Beverly Community Benefits Annual Meeting, which will be a readout on all of the needs assessments that they found and also where they are recommending they deploy their dollars. So that's more of a, you know, if you want to go, they would like us to promote it. They'd like to see a lot of the community there. Beach testing season is over. I feel like I'm reading the news here. There was a 14-week period, 116 samples were collected from 8 public beach testing sites. Over the course of the summer, 4 retests were made. We only had a single beach closure for a single day, which was Good Harbor Creek. on June 30th. So it had a high level day one retest, so we have to close on that one because of the history of bacteria. But the retest the next day was well within limits below 10. That's great. The smell by Good Harbor Creek, you guys might have been hearing about that. Yes, it's seaweed. I'm gonna butcher the Latin spelling here, Desiphonia japonica, which is a, sorry, Dad, he's very intelligent up in heaven. He would be frowning at me. But when it decays, it releases sulfur, rotten eggs, smells like fecal smell. So that is what people are smelling. The municipalities checked all of the pipes. We've checked all of the testing. We just retested the creek. It was under 10 from a bacteria standpoint. And we did a DNA test today. Cody stood in for Gabby following the chain of custody and waded on into the seaweed there.
You bet.
Just to, and that's at the mayor's request for us to just be sure that we can definitively say it's nothing but the seaweed. So we're really thankful that the mayor asked us to go outside of the testing window of beach testing and dive in and make sure that it was accurate. And then, sorry.
No, I just waded in. I could have dove in, it was plenty clean. Lots of things floating around, but that's just the ocean.
Yeah. I think we've already talked about the water drains that are at the beaches now, where we have signs that say, don't play in the drain pipe. And interns, we had 8 interns this summer. Intern season has ended. We successfully digitized 212 septic properties. It's a whole filing cabinet. We have many more filing cabinets to go. But what did they say? It took them 30 minutes a property.
Yeah.
So times 3,000 times 30 minutes. About a year, they estimated it would take with the current level of that support. Public health excellence dollars, when they do arrive, a big part of what we want to do is continue digitization of septic, and that would include bringing in a firm to do it properly. So that's an example of how we can do that fairly quickly in the fourth quarter if we get this money cleared through. We also built a tenant obligations training video that we're going to be using to help tenants understand their obligations under the rental regulations and the state sanitary code. We're updating the city social determinants of health metrics dashboard. So if you remember, we did the needs assessment and we created a PowerPoint that said how we are positive and negative against state norms. So we have an intern updating that. So every year we'll have an intern come in so we can have a steadfast dashboard that shows our trend lines against our social determinants of health. And Joe, if you remember, I'm forgetting the name of the woman, somebody had sent us a letter that was very interested in creating an SDOH dashboard that let us see, how we were trending as a state, as a city over time. So this will directly help that. So I'm pretty excited about that work being completed. We had other interns helping with the youth survey analysis, and I'll let Chelsea get on that because she's going next. And we also had social media support in Chelsea's department as well. So, taking advantage of college students, giving them the opportunity to work in the health department. One of our interns said she's absolutely going into public health and wants to work in the health department after her experiences scanning septic files.
We took her out in the world.
Yeah, that's true.
She got a taste of everything.
She got a taste of everything.
Yeah.
Seaweed.
She did do beach testing.
Yeah. And then the last thing is the kindness campaign that we created. Remember, Danielle made the mugs that I gave you all one. So that is going very well. There's been, I had a number here and I think it's a little deeper in your report, but it's going very successfully. The mayor's office has now taken it over and it's going through October 31st. People are submitting their recommendations. The individual who's wins goes to the mayor's office, shakes their hands and gets their mug. So they're posting that on Facebook. And what's fantastic about that is people celebrating the good rather than what can happen in our community sometimes, which is jumping all over, something or thinking things are bad and spinning that up. So we're really excited for that. And Danielle's got a really great, thing that she made that's bringing it to life. And that is the end of my recap. So I feel like I should do like a Jon Stewart moment. Yeah. Not nearly as funny. Okay.
I get to go
Chelsea,
first.
not batting last.
Thank you for this opportunity to switch it up.
course.
I know. Sorry, Cindy, you'll get a little
It's okay.
taste of.
It's fine.
Save the best for last, that's what I.
No, you know what I'm gonna do? I'm just gonna make it really quick.
Well, I'll still try to be quick. So again, I'm representing our prevention team, which is myself, David Tucker and Lisa Natty. Team of 3, which we augmented with interns, as Dominique mentioned. This summer, we had a graduate student studying public health who analyzed some of our survey data, youth risk behavior survey data, and also we had a parent survey that we had developed. And she had the opportunity to come in person. She came up from Pennsylvania. She was a Lehigh University Master of Public Health student, came up to Gloucester and was able to present in person to our coalition her findings, which was really cool.
Where's she a student?
At
Lehigh
Lehigh
University,
Oh,
It's
Lee.
my alma
the
mater.
School of Public Health.
Then the rest of it from there though.
She did, yeah, so she started remotely, and we had, weekly meetings on Zoom, and then she came up for a week and was able to come in person. We also gave her a little, David and Lacey gave her a tour of Gloucester, get a little feel. And she presented to our coalition on her findings, so that was really cool. We also had 2 undergrad interns, also one from Lehigh, and one from Clark University, helping us with our social media and digital communications presence, helping us revamp our newsletter, creating social media posts that we can use moving forward. So it was really nice to
Were
have.
they also offsite?
They were, yes, they were remote, because it was all digital. But again, we had Zoom check-ins every week and
Okay.
made sure that everyone felt good about what they were doing. So that was really great discovering.
We have to have
this.
bunk beds if we had all of them 8 in our offices. We have to have like stacks.
I know. Well, in this time of for us as a grant funded, mostly grant funded team, it's helpful to have unpaid interns who want to do this work and have a fresh perspective. So we may continue to get some interns even throughout the school year. So that's exciting. I'm going to call it a couple things. So just as a reminder, I'll ground the activities that I'm going to talk about in really our focus. Our overall focus is really on building community as a protective factor. We do that through emphasizing and supporting strong relationships between adults and youth, providing opportunities for youth engagement and empowerment, and providing opportunities for skill building for both adults and youth in supporting youth mental health. And so we're kind of hitting those 3 things in a variety of ways. This summer, we supported the Open Door and Gloucester Housing Authority in their summer meal distribution in the wake of grant funding cuts to the Open Door that didn't allow them to do the food distribution in the way that they normally do over the summer. So Lacey and I were at Willowwood Gardens every Wednesday, handing out summer meals to kids, and it was a really nice opportunity for us to build relationships with families there. We had a question of the day that we brought every week. So we asked kids different questions and they'd write/scribble their answers on the board, and it was really fun. For our Gloucester Youth Leadership Council, we had a backpack stuffing event on August 18th where they stuffed over 300 backpacks at the Open Door. And those backpacks were then given out later that week at Burnham's Field as part of the Burnham's Field Field Day that East Gloucester Church organizes. So it was cool because our kids stuffed the backpacks and then the backpacks were given out to Gloucester youth in preparation for school. I'm going quick, I'm trying to go quick. One of our Gloucester High School students took the lead in really organizing a financial literacy course in conjunction with Cape Ann Savings Bank, which is really cool. He was like, I think this is a skill that a lot of my peers don't have that they could really use. So with David's help and leadership and mentorship, they organized a 2-workshop series on financial literacy with Cape Ann Savings Bank that will physically happen at the YMCA. There's 26 students signed up so far. That's of the date I finished this report, so there
August
may be
18th,
more.
yeah.
And that's specifically for students in grades 11 and 12. So preparing for adulthood. So I can report back on how that goes. We have our regional North Shore Youth Leaders group, which is a high school group. We have we're going to Project Adventure again on Saturday, October 4th. If anybody wants to do the ropes course with us, we need all volunteers. And that's an opportunity to learn social emotional skills, and really an opportunity to kind of kick off the school year and get to know each other, because it's high school students from across the region, so they don't all know each other, and it's like a kind of a nice bonding opportunity. Two more things real quick. One of the themes that's come out of data collection that we've done both through surveys and focus groups and key informant interviews is a desire for more skill building among adults who work with youth on how to support youth mental health, how to build those healthy relationships and strong bonds. One way we're addressing that is through youth mental health first aid trainings, which are wonderful, and they're 8 hours. So that is prohibitive for a lot of like parents who are like, I can't attend an 8-hour training, but I do want to learn those skills. So we're developing a series of workshops this fall and winter aimed at parents, employers, and other adults who work with youth, like teachers, coaches. Those will be 90-minute workshops, so much smaller, but more attainable for a lot of folks. So we're in the process of developing those now with a regional work group. And then very lastly, working with Sophia, thank you, Sophia, for helping spread the word on a free tips training for responsible beverage service. We offered one in June. We're offering one again on September 23rd at the Cut in Gloucester. The Cut is very generously opening their space to any Gloucester business who wants to send staff to get trained on how to responsibly serve, make sure that you're not over serving, that you're properly IDing, so that we're ensuring that the roads are safe, that youth are not being served alcohol, and we're paying for that through a grant.
And they don't end up in front of the Board of Health.
Exactly. So it's free. And we
really?
it's free.
Oh, that's
It's free. It's free. So if spread the word. And Sophia has offered to use her contacts and her network to share the flyer. So thank you.
Did you talk about the haircuts?
No, but it's in here. I'll talk about the haircuts too. I'm sorry. So David Tucker, this is his own initiative. He organized a week of free haircuts at Debbie Barbershop, which is the old Jonathan's Barbershop across from Old Shaw's, last week. So free haircuts for any Gloucester kid in grade 1 through 8 were made available, and Debbie Barbershop donated that time. So they were like, yep, we'll take it. Like, just have parents call and make an appointment last week, the week before school started, so that students could get like a fresh cut for school.
Do you know how many people took advantage of it?
I don't. I'm gonna ask David to get that data. He did go a couple days and with permissions and signed consent forms, like where I was able to take a few pictures. So we can promote it, and then also Debbie's can promote it because they did a really wonderful service to the community. So we want to give props to Debbie's Barbershop. But it was awesome. And that was like all David's idea. He did all the work to make it happen.
Awesome.
So
Very nice.
I like going first. I can say as much as I want. Okay. That's it.
Thank you.
So we're gonna skip over Gabby's because I included hers in mine because I knew she wasn't going to make it. So we can move into housing. Rhea, are you still on the line?
I am, but I am driving home, so I don't have my report in front of me.
Let me cover it for you then, Bree. So 66 building permits, and importantly, the rental registry, you can see the number in progress. So 399 have been issued now. We have a big bolus of them. 420 of them are in process. Why are they in process? There might be things missing. They might have inaccurate data. So there's a lot of follow-up going on between building and health department with the folks that are applying.
So that number is in addition to the 300 and some, or?
Yeah.
Yeah.
Yep, 399 are completed, 420 are in process, 199 are still waiting to be opened and attended to.
So approaching 1,000?
Yeah,
We're over
1,000,
1,000.
yeah.
Great.
Yep. And interestingly, again, a lot of these are new. So part of the work that Bree is doing is going after Those people who had certificates of rental dwelling and, working with the building department to pull lists of those who have 2 and 3 families, likely landlords and have not yet registered. So we're gonna be pushing. That's why the November 30 date is gonna be helpful, so that we don't have to be punitive. She's had 5 housing complaints and 4 general nuisance complaints. We had so many complaints regarding seaweed smell. Like, I can't tell you, when we came back from the holiday, it's just, the phone didn't stop ringing about the horrible smell at Good Harbor Creek, but that led to a lot of investigations, and as I said, it was seaweed. In your document are all the housing complaints summarized. If you'd like to know anything more about them, feel free to reach out and we can help you. I already gave you an update on the internship. There's more detail on each one of the interns and the work that they're doing within your packet. Moving on to food, Sophia continues to move on. You wanna go?
Yeah, sure, absolutely. So we had another busy month, as expected with the summer season, just with events going on that I'm usually working 6 days a week. I have finished or completed 35 inspections. That doesn't necessarily mean that they're closed out. Hence why I have 26 in process. The correction timeframe, it may be a little bit, they still have time to correct. But as for completed, I have 22. No, either the re-inspections have been closed out, they corrected everything, or there was no need to re-inspect. Build out inspections, one done.
And that's an example of a restaurant changing things.
Exactly. Oh, that was Chipotle. Like, who was that? So you might have noticed by now that Chipotle opened its doors. I think it was last Friday. So that was that build out inspection. Very excited for them. Surprisingly, no new establishment plan review applications, which is very strange because they were really rolling in these last few months and things have slowed down on that front. We had one foodborne illness complaint. It was I talk about it later here. It was a Vibrio case. We actually learned about it, directly from the state. So Vibrio is found in shellfish. It is naturally occurring, but it can reach an unsafe or a level that will cause a foodborne illness, typically when there's temp abuse involved. So things not staying as cold, oysters not staying as cold as they need to. We were notified by the state on August 27th, even though they had dined at the location on August 8th. So foodborne illness, it tends to take time. It's a needle in a haystack kind of thing, trying to trace back. We were deployed to that establishment the next day. We did a full comprehensive inspection and we fulfilled our duties to the state, who then took it over from there or took it back. Let's see. I did touch a little on the enforcement process overview and the fact that this came before you today because I did have as we discussed, an establishment that just was not progressing in the right direction. But in good news, I completed the Tier 1 FDA food training. There are 3 tiers of this training that are progressively more intensive. So I'm done with Tier 1, which is about 30 hours of online coursework. It was a lot to get through, but we got through it just in the nick of time to apply for and be accepted into Tier 2. So that's going to be 3 virtual trainings and then 2 on site with a lot of the leaders in education on food inspection. So I'm really excited for that.
Good.
Good, yeah, I'm very excited. And that's all for me.
Thanks, Sophia. So moving into septic, since we have the personalities in the room, do you want to cover that?
You got it. Septic, summer has been, fairly active, but not too crazy, I don't believe. We don't have any backlog cases or plan reviews at all, kind of everything's up to date. We haven't had to have any of the septic review subcommittee meetings. I expect there to be a bunch of construction this fall. We've had 3 new licenses in the last couple days and issued a bunch of permits. So I think it seems like if it repeats of last year, like a lot of construction happening in the fall and some plan reviews coming in. Haulers are updating their permits this time of year, and so we should have everyone licensed by the end of the month. We have the stormwater quality assessment at 187 Atlantic, which is the large development on the way to Wingersheek Beach. finished up their field survey and we're expecting a preliminary or final field report with their model in the middle of September, so that might come before the board in October is, I think, more of a briefing as long as it hits the criteria. You know, I don't think the board has to actually, I'll review that again, but I don't think you have to approve it. Yeah, we're staying up to date on things. Me and Connor are gonna try to start meeting a little bit more collaboratively on crossing paths a little bit. Me doing some of, just working together a little bit more instead of him doing his stuff and me doing mine.
And that's really to manage workload more effectively, because Connor can get big boluses of it, and
Yeah.
and Cody and Connor working together makes for some good decisioning as well.
Good.
So,
And then the only thing I wanted to bring up with the board is so our plan approval letters that we issued over the last, that are still effective in the last 2 years before our regulation changes. Many of those letters had the condition that if you had an advanced treatment system, you had to sample it for 2 years, 4 times the reduction, basically, of testing. New regulations have since got rid of that regulation. So those plan approvals are kind of approved on that old regulation. So what I'd like to do, with your permission or my opinion, is that we should really, those plans as they come in and are constructed and those septic systems go in, we just reduce those testing requirements to our current regulations. So it is a reduction. But that's kind of what I feel is fair and what makes sense. That's why we changed the regulations.
Yeah, no, exactly.
And so, I just wanted to, I guess, get your opinion on that one small matter, but.
Any other opinion from either of you? I mean, that sounds reasonable. That's why we changed the regulations.
yeah.
But yeah, the septic world's been, I would say, pretty steady. The compliance side, on Connor's side, we're really. Yeah, he's really busy, so we're trying to figure out, what areas to go into and the pump out records, I think will potentially go out sometime late fall. Or the pump out requirements, I think is what we're aiming for.
What do you mean in terms of like the mailings to?
The mailings, yeah.
And Connor, are you still on the line?
I am.
Thank you for enduring with us. Do you want to
No problem.
speak to the work you're doing?
Yeah, I think that one of the main things I'd like to touch upon would be some of the stuff the rental registry has uncovered. And having that direct communication with people and being able to communicate with them, I found a lot of educational opportunities regarding explaining the local septic regulations as well as the difference between certain septic criteria. I've encountered numerous people. In the rental registry, there's a section that is listed for attached, septic maintenance agreement and attached septic rental advertisement. And that is so people are renting it as the correct number of bedrooms and also showing that they are having it pumped or maintained via an O&M agreement. And we've had numerous properties come in that thought that by getting a pump out, they were following the criteria, but we've had many IA systems come in that didn't know that they required an O&M contract. So they thought a pump out was sufficient. They thought that they were meeting, local regulations and state regulations by adhering to that. So there's been a lot of opportunity to educate and communicate and let people know that, which has been really exciting.
Thank you, Connor. Okay. And so on the admin front, I covered a lot of what Danielle's been doing. Danielle's in Portugal, by the way. She's fine. She was not in Lisbon last night. I texted with her and she's like, nope, we left last week. So she's, she provides information here on all the work that she's done for social media. We continue to have the campaign going for septic, and we are putting out posts now. Cindy's going to talk about some of the things that were going on. West Nile would be one to be sure you bring up. And then also, continuing to just promote all sides of the health department. So with that, let me just turn it over to Cindy for the last part of our meeting here on the communicable disease reporting.
So I'm not gonna go over everything. I just wanted to give a few updates since I wrote this report. So COVID-19, we are seeing an increase. It has been doubling for the past 3 weeks. So a couple weeks ago, it was 590,000 and now it's 1.2 million copies per liter. So it's like doubling every 2 weeks.
This is wastewater.
This is, yes, wastewater. I also wanted to talk about the fact that this year during influenza season.
I'm sorry, before you go on the same topic, can you talk about the vaccination protocols and
That's what I'm doing.
around COVID or,
Oh, yeah.
okay.
So, all right, because I was gonna, whatever. I'll talk about
Sorry,
that
if you
now.
want to just.
So no. Dominique and I have been talking and everything changes daily, as you know, with vaccine protocols.
I got you on it.
So we were thinking that we were gonna have to wait until, because I talked to the public health yesterday. And they said, we're gonna have to wait till the 18th or 19th of September where ACIP will have their meeting and they'll give recommendations. And then today, just before we came here, Governor Healy announced that she's taken steps to protect vaccine access in Massachusetts. So that the insurers are gonna be required to cover these vaccinations that are recommended by DPH, not solely based on what CDC is recommending.
So state level intervention.
Right.
Which is
So-
great.
I didn't look at what you.
So
Yes,
this
but-
is gonna ensure that Massachusetts residents can afford their vaccines because their insurance will be covering it. And the ones that they need and they want to keep themselves and others healthy. And even if the government is narrowing things, we are not here in Massachusetts. So the vaccines that they're talking are respiratory virus vaccines like COVID, flu, RSV, and vaccines for children like measles, chickenpox, or hepatitis B.
Will they require a doctor's prescription still?
So the Massachusetts, well, here in Massachusetts, they are going to cover that. So so the governor, she took steps to ensure that Massachusetts residents who want to receive COVID vaccine can do so at pharmacies even. So Robbie Goldstein issued a standing order to allow pharmacists to continue to provide COVID vaccines to Massachusetts residents ages 5 and older.
He's
So
the commissioner.
Right.
So CVS and Walgreens had stopped.
Yes,
doing it, and now
nobody
they're-
was getting
now they're
any
gonna
vaccine.
do it again.
Yeah, and we were gonna be talking to you about using our
Right,
budgeted monies
right.
to be able to provide payment if an insurance company can't, but thankfully now the governor has stepped in. It would have been anybody under 65 who's has not have an underlying health condition would not have been able to get a vaccination.
After what Florida
For
just did
COVID.
today,
Did you watch that?
it's astonishing.
Yep.
The stupidity is beyond my belief.
I can't go.
Yeah, I
there.
can't. hardly-
Daily.
But it's
just crazy.
fantastic that the governor stepped up at this
Yes,
clip.
and
as
so
did the
we're
public
lucky
health.
to live in Massachusetts, and actually Massachusetts is leading efforts to create a public health collaboration with the New England states, because they're all committed to safeguarding public health as federal government backs away from its responsibility.
So I made a copy of that same article, that letter from the DPH today, OLRH rather, Office of Local and Regional Public Health. So you have it on your desk there to read at your
Right.
leisure.
I read it before.
But it's interesting
Yeah.
because it's bipartisan support, like 100% of the state senators are.
And the
behind it.
nice thing, maybe not surprisingly, is the insurance companies back this.
Yes, they
Yes,
did,
exactly.
and I was
Sure.
impressed by that.
Well, because they're gonna have a lot higher
Yeah.
costs if they don't.
Right,
Right,
that's what I
right.
thought. Yeah,
Yeah.
I mean,
That's like a
they're
no-brainer.
actually,
Yeah.
it's actually to their benefit.
Yes, of course.
Yeah.
So the other thing I wanted to bring up was, in the past, we've had to administer flu mist. And it comes in a container like this. And you take it, put it inside in a child nostril. It's only for people ages 2 to 49, and they have to meet certain criteria in order to be able to get it. Effective this season, people are going to be able to
Get it
like
mailed-
order it online
Get it mailed to them.
and have it mailed to their house. I don't know how good that's gonna work. I'm a little concerned, but we gotta let this happen and see, we'll just have to see what's coming out. I was worried that things won't be recorded in like MIIS. And,
Right.
or people might not handle it properly or might not even give the vaccine properly. I mean, because you really do have to give it properly. So we'll see what happens. So this year I only have injectable vaccine for the kids at the school department. So that's gonna be fun with the little kids. I've got a lot of my vaccine schedule put together. I'll be starting at the senior housing on September 16th through the 19th, and I'll have all of those done, and then do Central Grammar Apartments. I'm going to Pathways for the staff. I have a City Hall clinic set up. I have GMGI set up, Fisherman's Partnership I'll be doing day by day. All the schools will be done on October 6th through the 8th. I haven't talked to Frank about the Grace Center yet. The annex, CADA Annex has already asked me to schedule a day for them. The Gloucester Public Schools teachers, I'm going to go to every single school on November 4th when they have I think it's like a professional day. And I'm going to the Energy Fair on October 28th. The other thing I wanted to mention was that we have an update from the arbovirus. Yesterday we got an alert, and they just wanted to update us that there was a case of West Nile virus on 8/15 to a 70 to 79-year-old female in Middlesex County, which she has encephalitis now. So that is the only human case that we've seen this season.
No, for West Nile?
In a human.
We had one yesterday for Essex.
This is the one. This is the
It was in
Southern
Essex,
Essex.
so it
They
was-
were just alerting us.
Oh, because they said in Essex County. Okay.
Was one in Middlesex County.
It
Yeah,
was
definitely one in
Middlesex, yeah.
Middlesex.
So
I thought this was the second one.
today I looked again this morning at the Triple E. They have like a virus summary results. So far this season, Triple E, there'll be 0 animal cases, 0 human cases, and we've had 18 positive mosquito samples, but none of those positive Triple E mosquito samples have been in Essex County. The West Nile virus, we had 1 animal case, and that was on 7/7/25 in Lunenburg in Worcester County. And then this 8/15 person that we just found out about recently. And then the positive mosquito samples, there have been 319 throughout Massachusetts, and only 13 of those were in Essex County. We have been moved to a moderate level, so we were on a low level. And so people did you put that out yesterday?
No, she's putting it out tomorrow.
Okay, so tomorrow we're gonna put out on our Facebook, what we need to do now. We just
Basically wear
added,
long sleeves, wear
which-
your
right.
protection.
it's
don't have
EPA
standing water.
repellent, don't go out between dusk and dawn. If you don't need to without, proper long sleeves, et cetera. Repair your screens. And the only added thing that they, that was
Standing
from
water.
4 to 5 was to get rid of the standing water in your yards 2 times a week. So that there's nothing hanging around. And to vaccinate your animals, et cetera. And keep your horses in their stalls instead of leaving them out, but that's that.
All the horses.
I don't think I had anything.
So Cindy, the one thing I noticed with the biopop, I think it's the latest biopop.
Yeah.
That there was a considerable uptick in fentanyl.
Yeah, I noticed that too.
It's only one data point, but still. it
That's
was
right, there's only
considerable.
one, so I did notice that. Did I
Does
put
the
that?
police
Yeah.
get those reports?
Yes.
I always, and I
But
have
he
been
has access to it. The
communicating,
chief has access to
right,
it.
and I've been
They have
communicating
access.
with the community policing people. And then that's what I did note it here, that the fentanyl was way up.
Yeah.
Everything else has remained, within or below New England and the national averages, so I think that's great. But that fentanyl thing, yeah. Yep, and that was on August 12th,
It may
that
have
we
been a
had
police
that
raid,
in our,
and it went down the toilet.
well, it could be,
Yeah,
honestly.
That's an
So-
interesting thought.
but the police have access to these same
Yes, they do.
dashboards.
And I guess that's I've been distributing naloxone every week when I've been going to the farmer's market, along with other educational materials. It's been fun. I didn't go this week for the first time because I went to a staff meeting instead. But I've been gearing like what's happening by how many naloxones I give out. So most of the weeks I've been giving 2 to 3. It rained like crazy last week. I only gave 1. So, I mean, we got caught in a thunder and lightning storm.
Yes.
So. So that's all I have.
Thank you.
Concerns of the board.
Concerns of the board.
That's sweet.
I don't have a concern, but I'm just curious. I know where we're down on a person since Thor had departed. I just wasn't sure if there was any movement on finding a 5th band member.
No, I mean, I've reached out to Weston and Sampson and haven't had any luck there. And I've talked to Thor about some of his colleagues, but haven't had any luck there. So it's still a little bit of a search.
So we're looking for
Someone in that
engineering,
discipline.
engineering side or medical doctor side, like the 2 things that we know we have to have. So, I mean, the nosy book is the next place I go, Joe, unless you guys.
Yeah, no, I asked Tony, my neighbor across the way, he had an event, ended up in the hospital.
Yeah. He wasn't at the biosafety committee meeting because of that event. Aaron, do you have anybody that you'd recommend, or Eric, do you have anybody that you'd recommend?
Nothing, I've seen a Weston and Sampson truck parked in my neighborhood, so maybe I'll leave something.
I see
on
one
the
in
windshield.
Gloucester.
And East Gloucester, I need
I
to
mean,
say.
there's a lot of employees that work for them that do wastewater treatment. And like, I think even one of them would be
I had the
great.
same idea.
Well,
Card.
I asked, cause I've
Yeah.
been seeing it, and I was like, I wonder who it is.
Yeah, I
Owner.
don't even know the
Something on
house now because he's always parked in front of the same house, like I know exactly where.
Did you have to live in Gloucester?
What he does?
Right,
I
which
was just-
they do, there's quite a few of them that live in
Weston and
Gloucester.
Sampson trucks
Yeah,
that
Cause
are.
they can take their trucks home, most of them are like the wastewater plant operators. But I think it's still a good,
Town now.
the owner does
Yeah, I
live in
think so,
town, yeah,
yeah.
Tony asked him.
What are we, who asked him?
Tony,
What are we asking?
I don't actually know him, but Tony did ask him, the owner of, one of the owner of Weston and
Oh,
Sampson, one of the owners
Reach out
is
on that one.
from Gloucester. And lives
That would be a terrific addition.
Yeah, I was just curious, but I'll keep that, I don't.
I know, and thank
Rich
you to the
engineering.
board for like standing in and doing.
Oh, no, I
double
was just
duty.
more curious, cause I've seen that truck and it was making me think about it, and then with Marco down, just.
Is Marco resigned?
Yeah, no.
Oh, no, just
No.
not here for, sorry.
Oh, just not here today.
No, no,
Yeah.
Did I miss something?
When you sit down. I
I'm
thought
sorry,
you
I
was-
just went down for
I know.
today, no,
Yeah.
sorry.
Yeah, family emergency.
So we must be
For work.
neighbors, Aaron, if you live right by that same truck that we walk by in East
Yeah, I'm on
Gloucester.
Mount Pleasant, so.
Oh, yeah,
Yeah,
right,
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 yeah.
I'm over there too.
Oh, yeah, yeah, I keep seeing it by the Cape Ann Stage Company, and I'm just, you know, stuck a note in the dash.
Yeah.
Not a bad idea.
But no, I have no concerns, that was more curiosity than concern, I guess.
Okay.
Anything else? Motion to adjourn,
So moved.
Second.
all in favor, yeah?
Yes.
Thank you all.
Yeah.
Thank you.
No, thank you.
Thanks for
I
the
got